The equipment we will be needing is a stethoscope and sphygmomanometer. Before beginning the assessment, make sure the client has rested for at least 5 minutes. No caffeine or nicotine should be ingested by client 30 minutes prior to testing, and their arm should be elevated at heart rate level at all times. Have your client seated with feet flat on the floor. Make sure their back is straight and supported by the chair. Lay their hands up on the table with palms facing up, and make sure arm is straight and not bent. If they are wearing a long sleeve or jacket, please ask the client to remove it since the cuff needs to be placed on bare arm. Next, you will feel for the brachial artery while also feeling for the pulse. When placing the cuff on the arm, make sure the artery arrow aligns with the brachial artery of the arm. Make sure the cuff is properly sized by checking to see if the mark stays within the range marked by the cuff. If the cuff is not sized properly, the blood pressure may not be measured accurately. Be sure you don't put the cuff on too tight or too loose. You should be able to fit 2 fingers in between the cuff. Next, take out your stethoscope and make sure the earpieces are facing away from you. If they are pointing towards you, you will not be able to hear anything. Tap on the diaphragm to make sure you can hear properly. Next, place the diaphragm on the brachial artery. Remember to turn the valve all the way to the right before pumping. Be sure to place gauge in a visible area in order to take an accurate measurement. Begin pumping to about 200 millimeters of mercury. When you reach 200 millimeters of mercury, begin to turn the valve counterclockwise, decreasing 2 to 5 millimeters of mercury per second. Listen to the dub sounds or cord cough sounds. The first sound you hear will be the systolic pressure, the last sound you hear will be the diastolic pressure. Remember to record data in even number increments. After obtaining measurement, release the air in the cuff by turning the valve completely counterclockwise. Remove the stethoscope, then remove the blood pressure cuff from the client. Remember to allow at least 1 minute of rest before conducting the following measurements.